special on Linkages meeting. It promises to be a very interesting afternoon. But as we get started, Kathleen, if you would remind people of some of the housekeeping items they should know about before we get started.
Absolutely. So welcome everyone. We're excited to have you with us today. As you can see when you come in, we're using Zoom for this meeting. That does mean that you have access to audio either through your computer or over the phone. I think default to computer, but feel free to switch it to the phone if you prefer. We just ask that everyone keep their audio on mute when you're not speaking. We should have plenty of time for discussion and questions and things like that, but that'll just help reduce any background noise as we go through the presentations today. Please do feel free to have your camera on if you're comfortable with that. Please feel free to put comments in the chat box at any point, questions in the chat box. If you have any difficulty with any of the technology for the meeting, feel free to drop us a note in the chat box as well, and we can help you troubleshoot that. Grace, who's with us today, will put a link to a copy of the slides in the chat box. So if you'd like to have a copy, feel free to grab those from there. And they'll all be available online after the meeting as well. And then just a final reminder, as usual, we are recording this meeting. So you do that for our note-taking purposes, but we also make that recording publicly available. So that will be available online or by request following the meeting as well. I think that's it for today, but if you have any questions, definitely just drop us a note and let us know. Thanks, Bill.
Yes, thank you, Kathleen. Well, as we usually do at the beginning of these meetings, because we have so many folks who tend to join us who are not members of the council, we like to remind everyone just what the mission of the Council on Linkages is. And so it's on the screen in front of you. Our intent, as you can see, is to improve the performance of individuals and organizations within public health. And we do that by fostering, coordinating, and monitoring collaboration among the academic, public health practice, and healthcare communities. We do it by promoting public health education and training for health professionals throughout their careers. And we focus then on developing and advancing innovative strategies to build and strengthen the public health infrastructure. The Council brings together 24 national organizations now. The number seems to grow steadily each year, plus the staff provided by the Public Health Foundation, again, to focus on workforce development initiatives that will broadly benefit the public health population and health workforce. So our agenda today is one of the simplest we've seen for a council meeting in a long time, because we're really focusing on the public health infrastructure grant and the Public Health AmeriCorps. So you'll be hearing from a variety of individuals today, letting us know progress that's been made in moving these funds out into communities. I should stop for a moment and ask if any council member has an agenda item they think should be added to this list. Are there any additions to the agenda? Hearing none, then I think we can move ahead. The Council on Linkages has been engaging our members and others in important discussions about revitalizing the public health workforce. In late November 2022, CDC awarded more than $3 billion, that's a B, $3 billion to 107 state, local, and territorial jurisdictions to recruit, retain, and train their public health workforce. And additionally, $65 million has been awarded to the Association of State and Territorial Health Officials, or ASTO, the National Network of Public Health Institutes, the Public Health Accreditation Board, or FAB, all of whom are Council on Linkages members. And those awards were made to assist health department grantees as they work to strengthen their workforce and programs. This is unprecedented funding that provides, we think, an unprecedented opportunity to build essential public health infrastructure. and for organizations such as those represented on the Council on Linkages and others to assist in ensuring the successful investment of these grant funds. Now, from CDC, we'll be hearing from Steve Reynolds, the Senior Public Health Advisor for the Public Health AmeriCorps and Public Health Infrastructure Grant, and Molly Kellum, Lead Public Health Advisor for Communications, Partnerships, and Policy for the Public Health AmeriCorps and Public Health Infrastructure Grant. In addition to discussing these new grant programs, Steve and Molly also will discuss opportunities related to the Public Health AmeriCorps initiatives. So without any more delay, let me turn it over to Steve and Molly and welcome them to the group. The floor is yours, folks.
Thank you, Bill. Good afternoon, everyone. We're gonna, we have a set of slides that we're gonna go through. Molly and myself, I'll take the first part, the infrastructure grant, and Molly's gonna talk about the Public Health AmeriCorps part of the grant. So you all heard from me, I think it was sometime in the fall, regarding this program. Let's go to the next slide, please. And essentially, just a real quick overview, which I thought Bill did a real nice job, but I'll cover it again. This program actually started, or the notice of awards went out on November 29th. We've got 110 awards, and that's 107 for component A and 3 for component B. So it's a multi-component grant over 5 years. And I'll talk a little bit more about who we funded in a second. The budget period for this year will go from December 1st, essentially 2022, all the way through, I think it's 2027, a period of 5 years. So let's go to the next slide. So what will the notice of, what will the program do? Essentially, as outlined, it's to work on workforce, recruit, retain, support, and train public health workforce, foundational capabilities, which I'm sure you all are familiar with, and strengthen systems and processes and policies. And eventually we will be putting some funding out the door to 64 of the funded jurisdictions to work on data modernization, to deploy scalable, flexible, and sustainable technologies. So if you look across the bottom of the 107, we funded all 50 states, 22 cities, 27 counties, 5 territories, 3 freely associated states. Next slide. One of the requirements that all of the grantees had are to hire a workforce director. So for once, probably for the first time ever across the nation, of the 107 grantees, we will have a consistent, seamless workforce body that can help us put in consistent policies across the entire public health system related to workforce, the hiring, the retaining, health equity. So we're very excited about this part of the grant. We think we're hoping that everyone will be able to hire within the first year, and we'll be able to use the power of this huge network that are in all of these public health departments as we go forward. Probably one of the most important parts of our grant is component B, and that is the funding of the 3 national partners, and that is ASTA, and then PHI, or the National Network of Public Health Institutes, and of course, BAB. And I noticed that we have representation of all of them here today, and you'll hear more from them. We're really excited about having the 3 of those and the power of those organizations. I know they're partnering with other organizations and bringing in non-funded partners, so we can harness the power of all of our network of public health organizations across the US. And so we're really excited about the work that they're doing. As I stated, we started with the notice of awards going out November 29th, and here we are almost 2 months in, not quite. And as you can imagine, Congress is already calling and they're wanting, results. What are you guys doing? What's happening? What are they? What's proposed? And we're just referring them to these 3 organizations. We're going to let ASTO and PHI and FAB handle all of that. So be prepared. And they're already hearing some of our questions and our need for them to move forward quickly. Because we're already getting requests and a little bit of pressure to move this program pressure already less than 2 months in, as you can imagine, because it's a huge investment and everyone knows how important it is to support the public health infrastructure. Next slide, please. Talking about the huge investment, first of all, for workforce, we have the $3 billion, all of that went out in the initial award. All of that money is available now. And of course, that came from the American Rescue Plan. We have $140 million for the foundational capabilities. That's in our FY22 dollars. We anticipate that we will continue to put out additional dollars in FY23 and for the rest of the years based on the new appropriations. And that's TBD. We'll talk more about that in the future. Data modernization, as of right now, we have not put out any dollars. We are assured that the original $40 million that we put in the NOFA will definitely be going out this year. But I think they're looking at the possibility of putting out additional dollars to the 64 grantees who are eligible for the data modernization. So stay tuned in that category. And of course, the excitement around component B and the national partners that we funded, $65 million out the door, plus an additional, or 65 million. And that's 45 million of ARP. One-time funding, and then 20 million FY22. We anticipate putting that 20 million out each year over the 5 years. So putting a total investment for component B for the partners at about 45 million over 5 years. So we're very excited about that, and I'm sure our partners are as well. Next slide, please. Recipients are expected to achieve several key outcomes by the end of the 5-year period of performance. This is really just a broad stroke of the outcomes that we've had in terms of short-term, intermediate outcomes that are expected. We do have a lot of evaluation work right now being planned and worked on, and our partners are going to play a huge role in the evaluation. And we anticipate over the 5 years there will be so many great outcomes from this funding and from the award. But we just wanted to give you a snapshot of some of the things specifically for workforce. Bottom line, we do anticipate that this will increase the size of the overall workforce and make stronger for foundational capabilities, make the public health foundational capabilities stronger, and so on. So next slide, please. So the evaluation of performance measurement will allow us to track progress towards the outcomes, document success and challenges, drive continuous improvement, build evidence for interventions. We'll also leverage data from existing assessments. We believe this is extremely important, and this was very much highlighted in our NOFO, is that the existing assessments out there that have been so powerful over the years, and let me add that these assessments are one of the reasons why we received this funding, because they've been so powerful in showing the need. That we want to continue to support these assessments, the PH Wins, ASTO Profile, Nature Profile, the FAB assessment and works, the accreditation work, and others with laboratory and CST. We want to continue to build upon those and utilize those assessments since they're already in place and working, and it will allow us to not have to resurvey or reassess our grantees. There may be some of that, particularly for those grantees who don't participate in such assessments, but we're really excited about the opportunity of supporting these assessments and working with them and seeing how they all fit together in terms of this puzzle of metrics and reporting and evaluation for this program. And of course, the performance measurement reporting will be completed in ongoing will complement ongoing work plan progress and financial reporting. So we're really excited about all the evaluation that's going to take place. Next slide. And everything that you would need to know about this program, and Molly Kellum's on here, and I just want to say what an amazing job her and her team's done on our website. You will find on the website, we are adding more every day. We will have detailed information about each of our grantees and what they're planning to work on. It'll be right here on the website. So I encourage you to visit our website as much as possible, and then there'll be frequent updates. Now next slide, please. I'm gonna turn it over to Molly, and she's gonna talk a little bit about Public Health AmeriCorps.
Awesome. Thank you so much, Steve. And thank you all for inviting us to join your call today. My name is Molly Kellum, and I'm a lead public health advisor at CDC, supporting communications and partnerships for both the grant that Steve just talked about, as well as Public Health AmeriCorps. So we're really excited to share a little bit more about the Public Health AmeriCorps program, and hopefully we'll have time for some questions at the end as well. So as all of us know, the public health workforce is our first line of defense against disease outbreaks and other health threats. And unfortunately, with decades of underinvestment, our workforce capacity has really been weakened. And we were thrilled with the announcement of the $7.6 billion in American Rescue Plan funding back in 2021 to focus on strengthening the public health workforce. So CDC received a portion of these funds, and we are using those funds to do a number of things. For example, as Steve just shared, we invested $3 billion of that ARP funding to support the Public Health Infrastructure Grant Program. And we also invested a portion of this funding on a historic partnership between our agency and AmeriCorps to establish the Public Health AmeriCorps program. So this groundbreaking initiative supports efforts to build a strong and diverse workforce that's ready to respond to the nation's public health needs. And at a high level, the program provides grantee organizations with needed workforce support so that they can meet the public health needs of their communities. And it also provides the Public Health AmeriCorps members with pathways to public health related careers or degree programs through on-site experience, training, and more. So at this point in time, we are actively in the 2022 program phase. So as part of that notice of award, over $60 million went out to 82 grantee organizations across 32 states and territories. And those organizations are in various phases of recruiting nearly 3,000 members. So last we checked, I think it was as of last week, there were about 1,100 members that were already on board to date. And this particular funding opportunity has a 3-year period of performance. So those grantee organizations that were funded in 2022 will theoretically be funded for the next, for 23 and 24 as well. Concurrently, there was another notice of funding opportunity that was open up this past fall. It just closed earlier this month, and we anticipate working with AmeriCorps to announce awards in mid to late April of the grantee organizations. And this particular funding announcement will have a 2-year period of performance. Next slide, please. So this is just a little snapshot, diving a little bit deeper into the grantees and the members to let you all know the next application period. So for the 2024 NOFO will likely open later this fall. We definitely encourage organizations to consider applying for that. It's a great program to be part of. Really, it's open to many, many different organizations, including local public health, state and territorial government, nonprofit, you name it, tribal institutes of higher education. Any of these organizations are eligible to apply to host one or more Public Health AmeriCorps members. And on the member front, so there are a combination, so organizations can choose to fund as many members as they need, and they can fund them at full-time or part-time opportunities. The website that we'll share with you guys in a minute actually has a location-based search tool so that members can look for opportunities in their community area, or if they're wanting to move somewhere and find an opportunity to serve, they can do that as well. One of the great things for members is that they do get the hands-on training. They receive a living allowance, an education award, and also are eligible for student loan deferment or forbearance. And there's a lot of different types of activities that these grantee organizations are having members work on. So everything from health education, community outreach, linkage to care, research, any sort of capacity support that these organizations are needing to support public health in their communities, they're training these members to do for them. And the last thing that I wanted to share with you on this slide is, in addition to working with AmeriCorps on this program from a broad perspective, we've also funded 5 national partners. You can see the list of partners there in the blue box to the right. So we're using the CDC National Partnerships Cooperative Agreement to have these partners support the program, both the grantees and the members. And while each partner has been funded to focus on different aspects of support, collaboratively, they're increasing awareness about the program. They're encouraging state, territorial, and local government health, public health to apply to become grantees. They're building connections between grantees and community-based organizations, and they're Also, helping members get jobs in public health or pursue degrees after their service year. Next slide, please. So this slide shows a quick snapshot of the different funding opportunities that are planned as part of this 5-year program. You can see the initial one was a 3-year period of performance, and then the next 3 will be 2-year periods of performance. So we definitely encourage you to keep an eye out for those funding opportunities that'll be announced later this year. Next slide. So in summary, we see Public Health AmeriCorps as an integral part of the solution to build a stronger and more diverse public health workforce that really does a good job at reflecting the communities being served. And similar to our public health infrastructure grant website, you can learn more about the program here at this URL. That's it for me.
Bill, you are on mute. Bill, you are still on mute.
Well, that's a rookie mistake. Thank you so much. Our thanks to both Steve and Molly for your presentation. And a reminder to everyone that we're going to deal with questions after we've heard from all of our scheduled speakers. So please feel free to add questions to the chat box as we go on, or hold them until the end. So with that, today we're also going to be hearing from these individuals and organizations. Amber Norris-Williams, who is ASTO's Senior Vice President of Leadership and Organizational Performance, Vincent LaFronza, NNPHI's President and CEO, and Jessica Solomon Fisher, FAB's Vice President of Program Operations. And due to a major FAB meeting today, Jessica is not able to join us live, but was good enough to provide us with a recorded message. So after we hear from Amber and Vincent will go on to the recorded message from Jessica. So with that, Amber, the floor is yours now.
Thank you so much. Hi, everyone. So glad to be with you today. I am really excited to share ASTO's planned approach to this work with some caveats. So next slide, please. It's no surprise in public health that we're building planes and flying them as we go. So I just want to offer a caveat as we get started that, while ASTO and our partners at NNPHI and FAB had clearly, vision and planned for how we wanted to do this work, we're really working hard to make sure that is coordinated and collaborative with one another and with CDC. And so, some of the things that we'll share may change as we go. And certainly as the work evolves over 5 years, we anticipate that it would as well. And making sure that we're, really focused on the needs of the grantees themselves. Next slide. So I wanted to share just kind of how ASTO envisioned our approach to this work. We really wanted to build from ASTO's strengths and bring in key partners that we thought would extend both our capacity and expertise that would meet potential needs that grantees might have. So we really focused our approach on what would agencies need in planning, in strategy, and leadership that's needed for the transformational change of public health modernization to occur. And so, I think, we're all, amazed by the B behind the dollars that are available right now. We also understand that it's, a down payment on what's really necessary in order to overhaul our public health system. And we have an opportunity to make some real progress here. And so, what we want to do in our work is really engage leaders in envisioning what's possible, connecting other efforts and funding sources, and thinking about how do all of these things come together in a way that moves us down the road in modernizing the workforce, our capabilities, and our systems for real progress. Additionally, we really wanted to build on some key initiatives that we've been developing and bring them to greater scale and reach. Next slide. So just some of our year one priorities. I think, with any new grant, this would probably be what you would be thinking about. A real focus for us right now are these relationships and mechanisms for working with our partners, and then really pulling in the folks that we've tapped as part of our expert partner collaborative, those who will extend our capacity and expertise. So, a couple of the things that we're working toward are, getting access to the grantee work plans and doing an assessment of those to identify priorities for the year and move forward. There's some other things that we're working toward collaboratively with our partners, communicating with the grantees, developing a TA triage system that makes sense across the 3 organizations, and communicating with the principal investigators of the grant, along with other key named individuals in the grant, and then working together toward a grantee meeting. Next slide. This is a visual of many of the partners that we are engaging through our lane of work. And, many of you are on this call, so we're really excited about that, including the Public Health Foundation. Next slide. And while we intend to be really responsive to technical assistance requests from the jurisdictions themselves, as I mentioned, we anticipated there'd be some key needs along this lane of our approach, and really wanted to bring to bear some of the assets that we already have in place by extending our reach and the scope of some of those efforts. So, we over the last 5 years have really emphasized leader development, whether that's through the leader development of our state health officials or of diverse executives leading in public health, our DELF program, which CDC also funds. So here the idea is that we want to extend the leadership development model for key component A grantee positions, including these new workforce directors, the informatics directors, and others that will be named that will be responsible for this vision and overarching strategy of public health system modernization. We know that the leadership is really essential to the success of all of these efforts, including, the culture change that's really necessary for how we move forward. Next slide. Additionally, we've been working to develop a new STAR Center for looking at culture systems and operations. This is really a peer-based review program that does a point-in-time assessment of administrative and organizational capacity in all of these areas. This assessment is an opportunity for agencies to really think differently about where they are and what solutions there might be. It encourages peer-to-peer sharing of best practices and can complement and support other important efforts such as accreditation. So we really hope that Component A grantees who are interested in deeper dives in their administrative processes can really use this process in order to move forward, again, along the lines of some key standards and peer advice. The next slide. We also know that staffing is probably the #1 issue that facing most of the jurisdictions in both identifying and hiring qualified staff that are representative of their communities. And so there are a couple of things that we saw worked during the pandemic, and we hope to expand along with identifying some new approaches. And next. The last thing I'll say is that, I think there's a real, there's an overhaul in the workforce at large. People have very different expectations of their employers, and local governments are no different. One of the things that we've been working with public health agencies on is a new culture change around well-being and resilience model called Public Health Hero. So our intention is, as this pilot comes to an end, to build on the lessons learned and expand this program to support all of the grantee agencies that would be interested in a focus on resiliency and engagement to adopt some of these evidence-based practices and programs. And then last slide. We also will be working to support the 64 grantees that will be working on DMI through learning community, grantee workshops, and other efforts. So this is, a very quick look at our plans, which again are under construction and will be aligned with those of our partners. I really appreciate the opportunity to share some of what we're thinking and planning, and look forward to the questions and discussion.
Very good. Thank you so much, Amber. We move along now to Vincent.
Thank you very much, everyone. I will share my screen. Can you see it?
Yes, we can.
Okay, great. Thank
Yep.
you. Thank you so much. And Amber, it's been a pleasure to get to know you as well. And Steve, for all the work you're doing at CDC, thanks. We are, as Amber said, we are building this as we fly it, but we have a lot of progress made, and we are very excited to be working with all of these grantees and all of our national partners. We are taking an approach at NPHI, ASTA, and FAB to make sure that we have a seamless approach with our grantees. So we'll have leads for different parts of the initiative, but we will all be together, in one voice in terms of how we support the actual grantees. I will also tell you that we have a national steering committee meeting every week, and that's been going really well. So ASTA will pretty much take more of a lead on the actual communications, and the first grantee meeting. Some of you will, I'm sure, be part of that. We are NPHI is developing some type of a triage system for the technical assistance. Some of the DMI efforts, the data modernization work that you all know about, that is part and parcel of this grant, including assessments, including using the tools that are out there. And then all of us, of course, are doing a lot of technical assistance provision. Once the TA requests come in, we will have a triage system for that for all of the grantees. And then FAB will be leading communities of practice, really, of course, part of the evaluation and lots of TA provision. It will be very important. We have all agreed that we speak with one voice. We have already developed an MOU and standard operating procedures about how we're all going to work together, including addressing the needs of all of the 107 grantees. As I said, we have a FIP steering committee that meets weekly. So any of these national requests that come in, we can vet them, and we can participate in some of your meetings like this today. And I'm sure there'll be more of that. So we make sure that this work is shared broadly across the country. We will have a number of subject matter expert working groups by different content areas across all of our partners. And we're still figuring all of that out, how it's going to work, so that we don't silo our partner work in the field, that we have a concentrated, integrated approach. And the whole idea of that is to make sure that the ease for grantees, we want to reduce the grantee burden that they have on working with TA providers, and also all of the things that they have to do within their states and their localities or their territories. As you know, this grant touches all 50 states and territories. And then, as Steve mentioned before, there is a very robust evaluation of the initiative. So we hope that as we are learning, we can let folks know some of the key initiative learnings, including state legislators, elected officials need to know what these investments are actually doing. If you haven't clicked the link, and I know there's been a lot of links shared with you all, it would be great for you to really get to know the grantees in your area. And so these active links will show you exactly how much they were funded in every state. And there's two important numbers Steve already mentioned. There's 107 in terms of the actual grantees funded, plus the 3 technical assistance providers. The other important number here is the 40%. 40% of the investments that CDC has made are expected to benefit local communities. And so this is a really important, I think, a component of this grant program, and we need to make sure that if we didn't learn anything from COVID, we really have to have stronger community capacity to protect and improve the public's health. And so what are we really transforming here? Well, I think of it in terms of information, humans, and systems and muscles. We do need to have better modernized data systems. There's a lot of information out there. How do we use it in a way that's going to result in more rapid improvement in health. And then, of course, the recruitment intention that everyone mentioned and training of people, the human element of public health has been extremely challenging, especially in this inter-pandemic period. Amber mentioned a lot of the challenges that the employers are having. We're all experiencing it. It's not just government or private sector. There is a real big experiment going on, I think, with human movement and expectations in the workplace. I know it, and across our network of institutes, we are dealing with it too, and people are finding new ways to reinforce their workforce and think about workforce in a different way. And then, of course, the longstanding public health infrastructure needs. I'm so glad that Congress has made these investments. I'm so glad that CDC's work has enabled that to happen. And we know that we have a lot of building to do. I'm sorry, so NMPHI's approach, you will see here are regional innovation hubs. These are workforce innovation hubs that already exist in the sense that we're not building new infrastructure. What we've done here is we've worked with the 10 strongest institutes in the country that already have been doing for the last 10, 20 years this work with their health departments. And then in those regional innovation hubs, we have spokes, which are the lines that you see, the smaller line. And those spokes are other institutes in those particular states that have done a lot of work with their health departments, both locally and at the state level as well. So the idea here is that each hub will be assigned to the regions. All 10 regions will have meetings with the grantees. The grantees will be able to request, through a triage system, the technical assistance that they need on a variety of topic areas. And the concept of the hubs is that we don't need to recreate the wheel. So the hubs will need to communicate and share both the TA and the lessons that are learned. So it becomes easy to advance the work of the grantees. And then also when we get to the dissemination phase of disseminating lessons learned for those that are not actually funded under this initiative, we will be able to have captured those lessons and have a dissemination approach to all of it. Our partners at NMPHI in this first, and we will be evolving this, but in the first iteration of the grant, we definitely plan on working with these groups based on some of the content needs that we know that we have. And we're really excited that we're going to also include nature, because we really believe strongly if we're going to transform public health after the, obviously at the table and a very strong partner, we do need the local perspective as well in terms of just where local public health can go in building a better workforce, building a more sustainable workforce. And then, as you see here, the Public Health Foundation is also included. We will be working with Ron and his team to figure out the training needs and some of those workforce needs that the health departments have with their technical assistance requests. And we're still figuring out all of how all those pieces will fit together with ASCA and also with SAB. I will stop sharing my screen. And just to finish up, just to remind everyone, we will have, when there are regional meetings of the grantees in those 10 areas, we will let people know. Some of you may want to participate in those meetings in your regions. And then we will be updating our website so that you can access the hubs as well, in terms of just, some of the resources that they may have. And as Amber said, we'll be doing national webinars and trying to share everything that we really can. So we're excited, and thank you for your time today, and we're certainly happy to take any questions.
Very good. Thank you so much, Vincent. And now, Kathleen or Grace, would you play the recording from FAB, please?
Grace, we're not hearing sound.
Yeah.
Hello, good afternoon, everybody. This is Jessica Solomon Fisher with the Public Health Accreditation Board. I'm so sorry that we were unable to join you live today, but I've recorded a quick message to discuss FAB's role in the CDC infrastructure work. I'm sure you all know the goal of CDC's overall effort and their more than $3 billion in flexible funding going out to the field to support governmental public health infrastructure building. This is just a quick image I pulled from their website that goes into a little bit more detail about what they're doing. You may also know that they have funded what we call Component B partners, that is ASTO, FAB, and the National Network of Public Health Institutes, to support what we call Component A recipients, or the 107 public health departments in all 50 states, Washington, D.C., 8 territories and freely associated states, and 48 large localities who comprise this overall effort that CDC is supporting. And we are truly approaching this as a one voice partnership. We are very early on, and we're still figuring out some of the details of exactly what it means to implement this tremendous opportunity. A little bit about FAB for those of you who don't know us. You can see here our vision, mission, values, principles. I won't read them to you, but most of you know that we are the national accrediting body for governmental public health departments, and we also house a number of divisions, the Public Health National Center for Innovations, the Center for Sharing Public Health Services, which is where some of our work is housed around obviously service sharing, innovation, being stewards of the foundational public health services model, and so much more, in addition to providing accreditation to this field. Our approach to this infrastructure work is laid out in this graphic here, and considering how FAB has available health department capacity and performance data to really look at what's going on in health departments, where are the needs, how are they performing against national standards, being able to develop a system to do analytics and translate that into action. So a handful of tools and resources that can support health departments and health department systems in their overall transformation efforts. Another way to look at that, which just lays out some of the models that we base our work on, like the 10 essential public health services, as well as some of our tools and resources that we've developed on our own or in partnership. Of course, we have the National Accreditation Standards and the Foundational Public Health Services Framework. We support a 21st century learning community of 18 states who are actively working to do transformation and modernization efforts, largely with the Foundational Public Health Services Framework as a backdrop. We have a tool to assess accreditation readiness. We have a new pathways recognition program for those not yet ready to become accredited. With our partners, we've created the Public Health Workforce Calculator, are soon going to launch the Foundational Public Health Services Capacity and Cost Assessment tool, and then of course have initial accreditation and reaccreditation, and view these not in any sequence, but simply as tools at our disposal, at your disposal, to help along your transformation efforts. And so what does that mean for the public health infrastructure program? Again, we're approaching this with one voice. All three of us partners, ASTO, NMPHI, and FAB, are working very closely together on all aspects of the development of a program to support Component A grantees alongside of CDC. But a few things we do know is that we will be creating the public health infrastructure data systems, which will be taking our data visualization tool and really growing that exponentially to be a really kind of one-stop shop for Component A recipients and for others. It will compile and harmonize data to generate visualizations to inform decision-making and action among the grantees. And so we're thinking about what kinds of existing data can be pulled into that and working closely with partners as we do the scoping for that. We will be co-leading the overall evaluation of the effort, and of course, we'll be providing technical assistance in areas where we have expertise. We're also working closely with partners on a workforce enumeration and a job task analysis, and much more to come on that in the future. And again, just working with our partners on overall collaboration and grantee support. And so we really look forward to sharing more in coming days, weeks, and months as these plans are more put into place. And of course, happy to answer any questions, not today since we can't be there, but feel free to reach out to us. Thank you so much.
Well, very nice. Our thanks to all of our presenters today. And we want to move on to questions and answers. Ron and Kathleen, have you been following the chat box perhaps? I think we have over 200 participants, so it might be easiest if people would put their questions in the chat box and we can review them and pass them along.
And Bill, if people raise their hand as well, that'll be good to manage. And I think most of the questions thus far have been answered. There was a question for Fab that we'll pass along to them.
And I have a question that I got directly from me related to directly to me that you can't see. So I'll just share that as well. It relates to the funding with the infrastructure grant. And the fact that there's a push in Congress to curb government spending, particularly from the Speaker of the House. How stable is this funding? Is the program funded for 5 years? Do you foresee any curbing of the funding by Congress? Or is this money going to go, what's going to happen with all the budget deficit talks in Congress? So I don't know, Steve or Molly, if you have any comments on that.
Yeah, honestly, I'd love to hear what our partners think. Sometimes they have an ear to the ground a little bit better than we do at the federal government. Certainly don't have the 5-year crystal ball, but do know that for FY23, we did receive funding for foundational capabilities. Very exciting that has happened. It's in appropriations. As you know, it's rare to have funding taken away once we get it that way than it is for it not to be sustained. So I think our expectation is to continue to grow this funding. I think everyone understands that the structure is important around foundation capabilities and workforce. And we do believe that the funding will continue, but I have no confirmation on that, of course, but maybe our partners know more.
Hey, Steve, if I can just add to what you said, I think one of the great things about this grant is that $3 billion for the workforce component from ARP all went out on November 29th, and the grantees do have the full 5 years to spend it. So that was the biggest chunk of funding that went out the door. So that, I mean, that's not going to go away. Obviously, it's already out the door. So, as Steve said, I think we're hopeful that annual appropriation for the foundational capabilities is going to be stable. We can't guarantee that, of course, but at least the biggest chunk of money is out there to be spent for the 5 years. Now, I do think we will need help because we don't want that $3 billion just to fall off the table at the end of 5 years. So we will need help really, figuring out how to continue the program beyond that, because we're not going to fix infrastructure in 5 years, unfortunately, because we're kind of climbing out of the hole. And then we need to keep growing, right? So there is that. That's all. Thanks.
There is a question in the chat box, and Donna, we will get to you. And thank you for the response. And I suspect for many of the organizations who are council members, for their elected officials to hear about the importance of all of this is quite important. I'll leave it at that. The question is, where do the existing public health training centers fit into this model with the 3 national partners?
Yeah, I can answer that, Ron. We went fast through all of our slides, but for each of the 10 regional public health innovation hubs, we have assigned a training center to those regions. So those training centers already exist. Obviously, we're leveraging existing HRSA investments, all of the training that they offer. We know through this grant, and I have a comment about the Congress too, but we know through this grant that there's going to be a lot of new hires into public health. And so we don't want to recreate the training opportunities for those. We've got lots and lots of resources that already exist. All of the 10 regional training centers already do needs assessments under the HRSA requirement. So we're going to also leverage some of those needs assessment data for, highlighting training needs, also for the recruitment processes as well, because health departments have to hire. I want to make a comment on the question about Congress, and I agree 100% 100%, Steve. No one has a crystal ball, but I think it's going to be crucial that all of us in public health, everyone on this call, we do everything we can to be good stewards of the money that has been invested. And the worst thing we can do is and this is where our technical assistance with the states and the county health departments are going to be important. It's very hard sometimes for government to spend money quickly, just given all of the processes that are involved in hiring and all of the different rules that people have, and the politics of state legislatures right now being a little bit reticent to grow more FTEs in some places, depending on where you live. So we're going to have to really support folks to have maximum success. Because we want to be able to go back to Congress and say, here's the story that we can tell you, here's where the monies have gone, here's the changes in the system, and we need to not only sustain those changes in the 5 years that we shall achieve, but we need to see more in the future. And we're going to need a lot of evidence and stories to do that. And I think that not everyone on this call can have a role in that. It's not a new problem in public health, but certainly it's a very high bar right now.
So Donna and Molly and Dr. Gilmore, and then we have also a couple of questions in the chat.
Great. First, Ron, thank you so very much for the invitation to join this call and this conversation. And thank you both, Steve and Molly, for your presentations at the highest level. And of course, the three funded entities. It's so great to see this money becoming available. And I think my question was actually, Vinny, similar to what you just said, the challenges that the state and local communities are going to face in trying to spend this money wisely, while at the same time looking at a sustainable infrastructure to extend beyond the 5 years of this funding. I'm certainly hopeful that we'll be able, ACPM and the preventive medicine residency programs will be a part of that infrastructure build for a sustainable future. But my question is really around the centralized communications or decentralized communications. So in your presentation, Vinny, you had a link to all of the 107 funded entities, and yet I'm just curious, what is the right interest level of those 107 entities? Direct communication? Are things coming through the national partners out to all 107? How and what have you even gotten to that yet is going to be the best form of communicating with each of these entities to really truly build those relationships with the residency programs, for example?
Yeah, it's a great question. I would like to hear from Amber as well, since ASTO is a lead on national communications. I will tell you, locally within the hubs, I mean, we know, and everyone on this call knows that local relationships matter, right? So one of the things, once we're right now funding our hubs, we're getting, all the agreements in place, it's underway. Once those hubs are up and running and we've got websites and they have these 10 regional meetings, that's going to be critical for those relationships on the ground in terms of people coming to those meetings, communicating with their hubs, learning the grantees. It depends on what needs to be communicated. There will be some things, and I don't know if you want to add here, Amber, but there will be some things nationally that need to be communicated to the grantees themselves. We don't want to inundate them with 7 emails a minute, but so we're going to figure out how to streamline that. And then of course CDC is communicating with the 107 as grantees, in terms of their relationship. So it will be very critical that we coordinate that well. And I think the local meetings are going to be important for your membership.
And I don't have a lot to add because I think Vinny covered it really well in terms of, we're working across the 3 organizations and CDC to have a more united communications front, because they don't need to hear from ASTO, FAB, and PHI, CDC separately, or in conflict with one another in terms of things that we're offering. So that's something that we do have a work group that's formed now, and we'll be meeting to start thinking through how that works. There'll also be a community of practice for the principal investigators, and that'll be certainly a way to share information. And of course, CDC always has the power of the direct communication with grantees as well. I just wanted to note, related to the preventive medicine fellows as a staffing solution, that obviously was part of our grant, and we'll work closely with Vinny in the hubs to make sure that that's clear to folks that that is one of the staffing solutions that is available as we get all of these. We're working on agreements with all of our TA partners so that we can extend that to the grantees. And of course, that all takes some time. So we're getting there.
Yeah, well, thank you so very much. Truly appreciate not only your responses, but the opportunity that lies ahead as well. So thank you.
So Bill, it looks like we have two more questions here, and thank you, Vin, for responding to the question, the other question in the chat box. Bill, you think that this is about all the time we have for these last two?
Mm-hmm. Well, yes, we've got 4 or 5 minutes. I don't know whether we can slip a little bit over that. Necessary, you can tell me from the PHF side, but let's get to as many questions as we can.
Great. So Molly.
Yeah, I'll make this really brief, but something that Vin mentioned about we're going to have a lot of new people joining public health and like training, and we don't want to have to reinvent the wheel. I did want to mention, and Michelle Carvalho from CDC is also on this line, but her team did an excellent job curating an introductory public health training plan for the Public Health AmeriCorps members, because they're brand new to public health as well. So there is a version of this training plan on PHF's train system. It's free, it's curated, and NPHI is actually working with that team to make sure it stays up to date. So I think that could be a really valuable tool for all of these new people coming into public health. It's of course, there'll be jurisdictional specific training that will need to happen, but just wanted to give Michelle's team a shout out and NPHI a shout out and let you guys know that there is a resource there to start with at least. And that's all for me, unless Michelle has something to add, or Vin.
I put it in the chat for you, Molly. Thanks.
You're so good about hyperlinks, Michelle. Thank you.
And Gary next.
Thanks so much. Wonderful overview. I want to raise a specific question, Vincent, that you brought out about the 40% and the must of local involvement. My very quick question at this time, and I'll go to the websites for more information, has to do with the contacts and the throughputs that would be used for the local level activity. Would that be state related public health departments and the local public health departments as well?
Great question. I think there are multiple answers to that. The first, of course, is the 107. Of the 107, there's a portion of them that are directly local, of course. So that's an easy answer. For the rest of the money, in terms of the 40% that gets filtered across the communities, we are going to have to track the evaluation. Of course, we're going to be tracking that. We haven't figured out quite yet in terms of how to contact those folks, but I think the hubs will be one of the jobs of the hubs as well. And I think there's going to be a role. We're in conversation with NACHO now. There will be a role certainly for NACHO. I worked there for 10 years, so I know how some of their communications work. But I'm not sure how they want to handle that in terms of just, the outreach itself. I would imagine we will also have for those that are part of the 40%, we'll have some kind of, communities of practice where they will also convene.
Thank you.
Yeah, I would just add that I don't think there's going to be a wrong door for those who are receiving funding through this program to access the technical assistance that's going to be available across all the partners.
Thank you.
Mm-hmm.
And I did want to just add quickly that Dr. Gilmore, I think you used the term the 40% being a must to local, and just wanted to put out the clarification that it's a should, it's a strong should. It's not a requirement of the grant, but we are really strongly encouraging our states to give at least 40% to locals that didn't get funding. I will say a lot of them have been really eager to do that. And I can't remember what state it was, but in their revised work plan, they had 81% of their funding going to locals. So I think it's going to be pretty impressive, but yeah, yet to be determined. So wanted to make that clarification.
Thank you so much.
Okay, thank you all. Ron, any more questions in the chat?
I think that is it, Bill.
There is one.
Oh, sorry.
There's one.
Let's scroll back up a Do the TA partners have any plans to address difficulties in hiring, specifically as grantees of component A interact with their civil service and merit systems?
Yeah, that was definitely a part of our application, was looking at some of the policy and political challenges that jurisdictions have in hiring, and working through policy academies and other efforts to help them address those barriers. So yes, absolutely, we wanted to work upstream.
Yeah, and this is one of the strengths of having the hubs involved, and CDC's wisdom of putting us all together as partners. So ASTO and of course nature have particular expertise around how to do that from a policy perspective. In the interim, while you're figuring that out, we also have a very long track record of some of our hubs being places where they can actually be the employer of the, you work for a nonprofit entity, but you're placed in a health department. We have, thousands of those examples right now around the country working. And when those health departments can then take on that person, they can be transitioned into the, state or local health department role. So what you don't want to do is to give back the money because you can't hire because you're working through the policy or whatever the obstacles are. So we see that as a sort of a surge sponge. So, and it works. We have lots and lots of years of experience, and that depends on the state you live in. And there's a lot of things we're going to have to work out with those hubs in different states. But it's definitely a capacity that they can serve in.
Wonderful. Well, thank you all. A special thank you to our speakers today. And of course, to those of you who have chosen to join us. We hope this has been informative and helpful, and I'm sure there's more to come as time passes. For the council members, I want to let you know that we have not yet scheduled our council meetings for 2023, but we'll be reaching out to you soon to do just that. So expect to hear from Kathleen. In the meantime, if anyone has any questions, our usual default is ask Kathleen. She'll find a way to either answer the question or get to those of us who can help her do that. So with that, I think we've come to the end of our time. Again, my thanks to everyone. Have a good evening. Be safe out there.